Hello everyone. So now we will be revising Parkinsonism in 2 to 3 minutes. Okay. Parkinsonism is a neurodegenerative condition. Basically, there is the basal ganglia. In the basal ganglia, you have these nerve fibers. Okay, so there are caudate nucleus, putamen. Okay, and these there are these nerve fibers which are present in the basal ganglia. When these nerve fibers gets degenerated, there will be Parkinsonism like feature. So it's a disease of the old age. So it's seen in more than 60 years of age. So Parkinsonism occurs as it is idiopathic. So Parkinsonism may be idiopathic. So there is something which is known as alpha-synuclein. Alpha-synuclein may be important factor for causing Parkinsonism. Lewy bodies. Okay. Now remember that secondary to certain drugs like haloperidol or metoclopramide, they can be Parkinsonism. Parkinsonism can occur secondary to trauma. Parkinsonism can occur due to increase or decrease in the level of PTH. Parkinsonism can occur due to manganese. Okay. So remember, more than 10 years and more than 20 years, the signs and symptoms are divided into more than 10 years, more than 20 years. More than 10 years, there will be motor signs and symptoms, where motor signs and symptoms, there's a triad. The triad is rigidity, bradykinesia, and hypomimia. The triad is rigidity, bradykinesia, and resting tremor. But also there is hypomimia in the case of Parkinsonism. Now, more than 20 years, there will be constipation, anosmia, sleep disturbance, and mood disorders. Remember why there will be mood disturbance and sleep disturbance? Because we all know that whenever we have dopamine, we have a happy, elated mood or a happy mood. Okay, secondary to dopamine. But whenever we have less amount of dopamine, what happens? Our mood disorder will be, there will be mood disorder. So the person might be depressed, the person might be sad. Okay, more than 60 years person who is persistently sad and he has constipation, he has resting tremors. Yes, constipation and resting tremors, this should point your diagnosis towards Parkinsonism. But resting tremors is always first and foremost feature that is shown in the case of Parkinsonism disease. Okay, so also there is posterior instability and there is a pull test. So whenever there is a tendency to fall in the case of Parkinsonism. Okay, so bradykinesia, there is a decrease in the speed, decrease in the amplitude of movement, and akinetic mutism, hypomimia, and hypophonia. So there will be less amount of hypomimia, there will be less facial expression, there will be the phonation will be less, that is hypophonia. Akinetic mutism will be there, there will be decrease in the speed. Okay, so what happens in this case, there will be pill rolling type of tremor. Okay, there will be pill rolling type of tremor. Okay, and the rigidity you will see here is a lead pipe type of rigidity. There is a lead pipe type of rigidity, and you can also understand this in the form of Frommage sign, or you can say a cogwheel rigidity. Now this rigidity, this resting tremor which is seen, it's also known as a pill rolling type of tremor, right? And this pill rolling type of tremor is actually, it will subside with voluntary activity. Okay, and disappears at sleep. Okay, snuffing gait or with quick and short steps. Okay, so snuffing gait with quick and short step will be seen. Whenever turning around, he takes more steps. Okay, while turning around, he will take more and more steps. So there is basically a mechanism where there is freezing, fascination, and propulsion. Okay, freezing means inability to start the movement and continue the movement. Fascination means short, increasing, quick steps. Propulsion means forward leaning gait is known as propulsion. There is also micrographia, small handwriting, and hypomimia, low degree of facial expression. Okay, if there is known as shy-dragger syndrome, it is known as Parkinsonism plus autonomic symptoms, where you will have urinary incontinence, erectile dysfunction, and orthostatic hypertension. Remember, postural hypertension is always seen in the case of Parkinsonism. And remember the pull test. So there can be Parkinsonism dementia, which is very difficult to treat, and it is difficult to manage. Okay, so diagnosis and treatment we'll be talking in next video.